You're watching Africa 360 here on Arise News with me, David Glencorse. And joining me now is award-winning public health specialist, Dorcas, who is part of the UK's Royal College of Nursing International Reference Group and who has a wide experience of projects in Africa. Welcome, Dorcas.
Thank you.
An epidemic, we're hearing from Charles Aniagola, of medical malpractices. Your immediate thoughts, I mean, you've got to have money to be sick in Nigeria.
You don't. You shouldn't have to, because the health is a government's responsibility, David. These are what we call avoidable deaths. These are needless deaths. And Charles is right. They invariably affect women. And if this is the picture that is happening in Abuja or Lagos, can you imagine the picture in the rural areas, where women, families have absolutely no power whatsoever to complain or to share their stories? So the picture is not just a Nigerian picture, it's very much an African picture. Health as an entity in Africa gets very poor budgeting. In Nigeria, it'll be competing with security. So the security budget will be very, very strong. When you get to education, when you get to health, and then you get to mental health, you can imagine that's where it gets much more constrained. But let's be very clear here. Negligence at this level is a systematic negligence. And then there's individual negligence. Staff who just don't care.
Sure.
It's not uncommon in healthcare systems in Africa for clinicians to have private service, private care. So they'll be working their jobs in their healthcare systems, and then they'll be pushing more hours outside to push up their wallets. So there is almost a systematic negligence that needs to be looked at. But I expect more from Nigeria.
Very, very disturbing, some of the witnesses there, some of the patients. But apart from anything else, I mean, to get right down to it, I mean, in Nigeria as such, there are only, what, 900 doctors serving a population of, what, 160 million people. Yeah. And as you were pointing out there, it's okay for folk in urban areas who can afford, but those living in rural areas, it's a completely different story.
I think what's lacking is an independent body that scrutinizes clinicians' practices.
Right. There's no control.
Absolutely. You must have a body that is external to the healthcare system that peeps into what's going on and says, oh, hang on a sec, we're not very happy with this. And patients themselves must have confidence that they can report good practice and bad practice to this organization, and that is what's lacking. But more critically, Africa's leaders just don't use their own healthcare system. Buhari broke his promise. He said, no, I will access healthcare systems in Nigeria, and off he was on a plane. It is fashionable for them to fly off to Singapore.
He's saying now, I mean, he said quite recently, within the past few weeks or so, he's promising, let's put it that way, to revise the whole national health policy. I suppose that to a great extent is encouraging, and he's saying that there must be a particular focus on the poor and the vulnerable. So he's saying it again. Do we take it as read that things will improve from what he says?
I would like the grassroots leaders to acknowledge there's a problem. I was disturbed with the gentleman who came.
Well, he said it's not as bad as people are claiming, and obviously he was refusing to admit, as Charles Aniagola put it, that the errors are actually happening.
Absolutely, and if he's saying there isn't a problem and acknowledging that there isn't a problem, then can you imagine how many mistakes are just never reported in our quite tact way? I think capacity within Nigeria is absolutely there. Let's remember, David, this is the country that fought off the Ebola crisis off its shores some years ago. That's capacity. When it's called upon them, they're fighting in a polio program at the moment. When it's called upon them, they can do it. The only problem in Nigeria is that the elite is very creamed up.
Sure.
It's extremely wealthy, and they don't access the healthcare system, nor do they push the agenda for the poor people.
And this is why people...
And this is critical.
This is why people must be so very, very angry, because they see an elite who have all the money, and who, in some cases, whether it be politicians or administrators or whomsoever, there's billions going missing from public accounts that could easily be spent on healthcare and other stuff besides.
Absolutely. And I think that gap needs to be addressed somehow, some way. We have a very vocal civil society in Nigeria, which stands up for human rights in many angles. It needs to stand up when it comes to health, because it's not good enough.
One of the patients there, one of the ladies was saying that protesting as such is very, very new in Nigeria.
Quite.
But that's encouraging that such a campaign has grown and is going places.
But I think generally in Africa, people do not feel that protests necessarily need to a change of action. And we have to have a protest, peaceful process that leads to a change of agenda. I have some confidence in Mr. Buhari that if he listens to these stories, some sort of change will come together. But we're missing an opportunity here. Nigeria is missing an opportunity to rise up its healthcare system so it becomes a healthcare system that becomes a private healthcare system where people can actually access it. Do you remember when many West Africans come to Nigeria to access their healthcare system? So we're missing an opportunity to grow the economy as well as improve the healthcare of all Nigerians.
Okay, Dorcas Guata, thank you very much indeed for all of that. Yes, we've been looking at public health in Nigeria. As we have heard, there are major challenges ahead, but a grassroots campaign to improve the care of patients and make medics more accountable may well be the way forward. You've been watching Africa 360 with me, David Glencross. Thank you to my guest, Dorcas Guata. For now, from me and the entire team here in London, goodbye and thank you for watching.